comes in the domain of ours. So you all know, this is known to all of you, cleaning is the removal of all foreign material, that is dirt, organic matter and microorganism from an object. And primary cleaning is very important when the instruments come from the end users, particularly from the OT. The primary cleaning is to initially remove all the foreign material from that. That is very important. So after that it comes to the CSSD, and there the disinfection and sterilization. So disinfection is only killing of the pathogenic microorganisms, and it is not necessarily that all the viable spores or the spores are also killed, because the spores are mainly of organisms, the heat resistant spores are organisms which are not pathogenic. But sterilization is a process by which an article or medium is made free from all living organisms, including the spores. So primary or prior cleaning of instruments is a vital step, as I already told you, and it should happen in the OT itself. And then the sterilization, we are all aware of these systems of sterilization, the steam sterilization, then ethylene oxide sterilization, then the plasma sterilization, hydrogen peroxide gas plasma sterilization. And steam sterilization is for the heat stable items, but which are heat unstable items, which are cause damage, heat may cause damage to them, are usually sterilized by ethylene oxide sterilization or plasma sterilization. Besides that, we have the liquid chemicals, the peracetic acid, which are recommended for the endoscopes and those things, and ionizing radiation, which is pre-sterilized, all the gamma radiation, etc., is used for the pre-sterile items, which comes sterile. But we have to check whether they are sterile or not in the laboratory, or we do that regularly. And the dry heat sterilization and ozone sterilization. These are the different forms of sterilization throughout the globe, but we are commonly using the autoclave, the EO sterilization and plasma sterilization in the CSSD. So autoclaving and EO sterilization have been shown here, and now coming straight away to the monitoring of effectiveness of sterilization. You are doing the sterilization, whether it's effective or not, that is very important. Just like I mentioned that we check the sterility of the pre-sterile items, which are pre-sterilized with gamma radiation, like the culture pots, the syringes, needles, the infusion bottles. You know there are certain outbreak. Recently it happened in a hospital in West Bengal that many patients were infected with a fungus which was in the saline bottle. So we have to check the sterility for those things also when they come. The lot verification is done. One important step is the checking the sterility by culture. So that we do. Once, if one bottle is found contaminated, then the whole batch is discarded. But here you are sterilizing the items which are coming from the patients, used in the OTs, in the other units of the hospital, which are coming daily. So you have to monitor the sterility of the sterilization, and you have to take this very seriously. All of you know about these things. So the sterilization procedure should be monitored routinely by using a combination of mechanical, chemical and biological indicators to evaluate the sterilizing conditions and indirectly the microbiologic status of the processed items. So mechanical monitors for steam sterilization include daily assessment of the cycle time and temperature by examining the temperature record chart or computer printout of the record chart. That is an important document you have to keep as record, and an assessment of the pressure via the pressure gauge. So for ETO sterilizers, it includes the time, temperature and pressure recorders that provide data via computer printouts, gauges and or displays. Generally, two essential elements for ETO sterilization, that is gas concentration and humidity, cannot be monitored in healthcare ETO sterilizers, but the other things can be monitored. Now coming to the chemical indicators, this is also very important. All loads should have a chemical indicator. Every load should have a chemical indicator. So chemical indicators should be used in conjunction with biological indicators as per NABH and NABL. I am myself an NABL assessor. So as per NABL and NABH standard, what we tell, we have to use the chemical indicator for every load and make a biological indicator at least once weekly But for implants, with every implant, you have to put a biological indicator. That is the recommendation, but you can use it more frequently, biological indicators, but chemical indicators should be used with every load. But based on current studies, should not replace the biological indicators. So you have to use biological indicators also, only chemical indicators won't do. Because they indicate the sterilization at marginal sterilization time, and because only a biological indicator consisting of resistant spores of the very heat resistant and sterilization resistant bacteria like Bacillus stereothermophilus and those things. So they can only measure the microbial killing power of the sterilization process. So chemical indicators cannot replace biological indicators, but they have to be used in conjunction with biological indicators. And chemical indicators are grouped into 5 classes based on their ability to monitor one or multiple sterilization parameters. If internal and or external indicator suggests an inadequate processing, item should not be used. So there are 5 types of chemical indicators. I am not going into the details because most of you are aware of those things. So this is how chemical indicators are used, you all know, but I am just telling you this thing. Chemical indicators are affixed on the outside of each pack to show that the package has been processed through a sterilization cycle, but these indicators do not prove sterilization has been achieved. Preferably a chemical indicator also should be placed on the inside of each pack to verify the sterilant penetration, how far. We are talking about the paper, so how the paper is porous, the steam should go inside, or hydrogen peroxide should go inside. So those usually are either heat or chemical sensitive inks that change color when one or more sterilization parameters like steam time, temperature and or saturated steam, ETO time, temperature, relative humidity or ethylene oxide concentration are present. So they change color from one to another. You all know of different types of chemical indicators. I am not naming the brands because I don't have any conflict of interest here. So I am not promoting any particular brand here. I come here as a microbiologist. So the chemical indicators you can choose from a variety of, there are a variety of chemical indicators available. Now sterilization cycle verification, 3 consecutive empty steam cycles are run with biological and chemical indicators in an appropriate test package or tray. Each type of steam cycle used for sterilization, that is vacuum assisted or gravity assisted, is tested separately. There are 2 types of autoclaves. One is vacuum type, one is the gravity assisted type. So in pre-vacuum steam sterilization, 3 consecutive empty cycles are also run with the Bowie-Dick test. I am not going into the details of this because these were routinely practicing, but it is the recommendation and it is mandatory also, not recommendation. The sterilizer is not put back into use until all biological indicators are negative and chemical indicators show a correct endpoint response. So the color change should be there. Now coming straight away to the biological indicators, our role is mainly with the biological indicators, the microbiologist's role. So biological indicators are recognized by most authorities as being the closest to the ideal monitors of sterilization process because they measure the sterilization process directly by using the most resistant microorganisms like the bacillus spores, and not merely by testing the physical and chemical conditions necessary for sterilization. Since the bacillus spores used in biological indicators are more resistant and present in greater numbers than are the common microbial contaminants found on patient care equipment, normally we find the regular microbial contaminants like Klebsiella, E. coli, the Enterobacteriales family, Staphylococci, Streptococci, Enterococcus, these are all less heat resistant, even Mycobacterium tuberculosis. That is also less heat resistant than the bacillus spores. So these common microbial contaminants are found on the patient care equipment. So the bacillus spores are more resistant than those. The demonstration that the biological indicator has been inactivated strongly implies that other potential pathogens in the load have been killed. So the indicators that we are using, these are not pathogenic generally, but once they are killed, they imply that the pathogenic microorganisms have also been killed. So an ideal biological monitor of the sterilization process should be easy to use, it should be inexpensive and not subject to exogenous contamination, provide positive results as soon as possible